What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we will cover how often do you find yourself in the hospital having to change x-ray orders. So for this one in particular, let me see. To give you context, if you're new to the channel, I work at a trauma 3 ER night shift. So let's see. So certain exams, depending on your system and how all that goes, certain exams, if they're ordered, mess up with how the rads or something with filing, with billing and stuff will get messed up, and they'll order it, and sometimes even some orders they'll come in, you can't even use them, like it won't even spawn in onto your portable machine or all those stuff. And I'm still not sure why our system hasn't fixed that or gotten rid of them, but certain stuff you have to pay attention to. Or if they order, like, let's say our standard everywhere, like for instance, let's say it's a foot, right? It's, AP oblique lateral. Sometimes the doctor in the emergency room will order a 2-view. So you gotta go in there, change it. Most of the times you only have to shoot a 2-view, or even something 1-view if that it's broken and they're wanting to like put a cast on it. So you'll usually do 1-view, or you do stuff like that. Or on the floor, sometimes because the patients aren't as mobile, they will put in a 3-view and the patient isn't able to, so you'll have to change it. So depending on your patient and how it is, I mean, obviously if something is like super broken, most likely you're probably only going to get an AP in the last, so you had to switch it to 2 views. So that happens a lot. Most of the time, a lot of the residents, every couple of years, we'll get brand new residents who are still trying to learn our facility, so they'll start ordering stuff wrong. Then you'll have to go in, especially for morning portables, you'll have to go in and change stuff so it can be acceptable for the rats. That's something that will happen. Or let's see what other situation. Or sometimes they'll certain areas of the floor on the hospital, like let's say the surgery center, if they need something done and they put a chest x-ray surgery, us as the normal ER non-surgical, like the techs who are in the surgery, can't use that exam because we're apparently something with the system doesn't allow us to link it up, so they had to switch it from a surgery like chest x-ray to just a regular portable x-ray, stuff like that. Easy fix, nothing crazy like that. You'll have to end up changing stuff like that. Or sometimes they'll order the wrong leg. That's really common, or wrong shoulder, because like if it gets busy, sometimes the doctor will forget and they'll order the wrong one. So always double check with the patient, or because sometimes the doctor will order the wrong stuff. And once again, you are always the one who's responsible. It always falls on you because you're the one who pushed the button and radiated the patient. So it always falls on us, the liability. Same for double checking the patient. Sometimes they'll put an x-ray on the wrong patient, you gotta change it. And I know what you're saying, Miguel. How do you know? Well, if they ordered a shoulder x-ray and the patient's coming in for some completely different stuff and they question you about it, you might want to talk to the doctor who ordered it, because they do end up messing up. And you got to check even more the orders when it's super busy, because the doctors have many patients and they forget or get them confused. One time a doctor ordered like a foot on a patient, and we got in there, I'm like, he ain't got no foot, it's amputated. And then it turns out to be a completely different patient. sometimes they'll order, like if they have, like if they're amputated from their knee, they'll order a tip fit for that little nub they have, and I'm like, this is considered a knee x-ray. Like, come on. Like, it's simple stuff like that you have to change. Let's see what other times. So we're always told by our supervisor that the doctor or whoever put in the order is the one that has to change it because it's the most proper way. But sometimes if it's really busy, they don't get to it, so you have to go in there and change it. And then occasionally, if they forget to order exams, you'll call. And if they still don't do it, you call again. If they don't still, because they busy, you are able to make your own order. Or sometimes you'll have to order something because you some like glitch happens, so you basically duplicate the order, delete the wrong one, or delete the what's it called, the session number, and resend it, link it up. Sometimes stuff happens like that. Or if they order a hip and they just put a hip but you shot a pelvis, if they're asking you to shoot more stuff, then you just have to switch the order to match what you're doing and stuff like that. Because the rats have a protocol, they're not as aware with it. I don't know what's going on. They don't communicate as much. They're not aware of what the rat wants and stuff like that. Or for like NG tubes or some tube placement, sometimes they order a chest, it's all the way down in the stomach, and I had to switch it to KUB. That's another thing that'll end up happening from time to time. Let's see what else can I think of. For the most part, I think that covers all the bases of the stuff that has to be changed in your facility. But once again, all depends on where you work, how how the system works, and anything that has to be ordered, kind of goes based off the rats and how they do their work and stuff. So keep that in mind. Everyone's different. And yeah, it's been your boy Miguel. Hope you enjoy your daily dose of radiation, and see you.